My son Henry was diagnosed with a rare fatal disease when he was 2 weeks old. And as a result, we had to spend a lot of time in the hospital, hundreds and hundreds of nights. And we found that it was really easy to access great medical care, but none of the hospitals had any sustained services that recognize that kids like Henry are totally normal kids. And they want to have a birthday party on their birthday, and they want to trick or treat on Halloween. And so when Henry died at age 7, we decided to start an organization to fill that gap in services.
We're very excited to bring Hope for Henry to Cleveland. We know that it's going to help some of Cleveland's sickest kids with their patient experience. It's going to help them do better. We think this could be a wonderful partnership for the city of Cleveland.
Here at the Cleveland Clinic, in a lot of children's hospitals, patient experience has been a buzzword for many years. But for the pediatric patient experience to be in their mission statement and what Hope for Henry is all about is really what we were looking for, because we know how important the patient experience is, but for kids, it can look a lot different than what it does for adults.
The Cleveland Clinic is always looking to improve what they're doing. And Hope for Henry is an innovative, fun, creative program that clearly can be used and implemented at any children's hospital.
It didn't take long until everything came together, and now Hope for Henry has an embedded child life specialist who works full-time at Cleveland Clinic Children's, and our program is up and running and just making a tremendous difference in the lives of kids at the clinic.
We came to the Cleveland Clinic Children's after our son Colton became suddenly ill. He went into heart failure very suddenly, and we were told that he needed to have a heart transplant.
So most children come to me before they, with normal lives, they were well children, and then all of a sudden they present to their family as sick and it looks just like a flu, and the next thing you know, these children come into the hospital, and not infrequently they wake up with these IVs and external artificial hearts. And how do you explain that to a 4-year-old? How do they get this and move on with their lives and continue to be children?
Child in the hospital, life is completely turned upside down and abnormal. They are just totally out of their normal everyday life. And so our job is to help try and normalize the experience in the hospital as best as we can, given the experience they're having and the situation that they're in. Hope for Henry allows me as a child life specialist to provide these amazing resources to families. So we bring in the Hope for Henry birthday boxes. We also have the Super Path to Super Duper Better, which is the incentive program that comes easily together in this nice box that we can present to families to say, this is a program that we can offer to help your child get through a difficult hospital stay, get through a difficult procedure.
It empowers them, because a lot of times the children feel like when they come in here they lose all power. They can't even, they need someone to go to the bathroom with them, they need someone to help them eat sometimes, they have the IV in their hand, so they're really restricted. And if they get to choose what journey they're going on with the Hope for Henry incentive program, or what superheroes they're going to be able to see and take their pictures with, that's just one other choice that's empowering them, that their voice still matters.
I'm a Spider-Man.
The box definitely helped him get through it, and sometimes when he did extra good, he would get some bonus bucks. There were quite a few days where he got some bonus ones just because he did so well.
The in order to sustain a program is you always need people to give. But I also think what we need from them is, as we've launched this, is their involvement and to come see what is happening firsthand. Because once you see it firsthand, it's very hard not to get involved.
It will allow us to help some of Cleveland's sickest kids. It will enhance their patient experience. These kids will do better, and it feels good to see these kids smile.
Hope for Henry does a lot of good for children in the hospital. It does a lot of good. When they're smiling, we're smiling as well.